Hello, hi, good evening. Today, I'm gonna go ahead and perform my abdominal assessment and my nervous system assessment on you. I'd like to introduce myself. My name is Angelito Agurilha. I'm actually one of the student nurse practitioner to perform this assessment. For anything else, can you tell me your name, please?
Marie P.
And tell me your date of birth.
November 2073
All right, perfect. And then tell me where you at right now.
at the clinic.
Okay, what date it is?
It's Tuesday.
All right. Uh, all right, to perform this abdominal assessment, I'm going to ask you to do me a favor if you could lay down on the bed, okay, so that we can proceed to this assessment. And this is actually the note that I'm going to use throughout the exam, okay? So if you could do me a favor, I'm going to ask you to pick up your shirt for me so that I can expose your abdomen and I can start to visualize your abdomen. Okay. All right. So let me go ahead and inspect for your the skin and the contour of your abdomen. And with that, so I'm gonna go ahead and check for any sign of discoloration. Thank you. Let me go ahead and check for any sign of discoloration, any sign of rash, localized bulging on your abdomen, and of course, I'm gonna check for any scars, and then I'm gonna go ahead also check for the temperature of your abdominal skin. Okay, touching is okay. Looks like you do have a warm, dry skin on your abdomen. All right. Of course, also I'm gonna check for any sign of abdominal distension, enlargement, or any sign of ascites on your abdomen. And looks like your abdominal appearance is normal to me. Okay. And then we're gonna go ahead and proceed to do. I'm gonna observe for your peristalsis and pulsation. And by doing it so, I'm gonna take a little time here and observe it for at least 20 seconds. So by checking with the peristalsis and pulsation, this I could identify for any sign of small bowel obstruction, any sign of internal hemorrhage or bleeding, I guess, or any sign of um, abnormalities. So it looks like you do have a good rise and fall in your abdomen. All right, perfect. And then let me go ahead and grab my stethoscope. This time we're gonna go ahead and auscultate the four quadrants of your abdomen, which is actually you do have the right upper quadrant, the right lower quadrant, left upper quadrant, and the left lower quadrant. Okay. So we're gonna go ahead and listen for your any abnormalities. I'm gonna listen for your bowel sounds. We're gonna check for any sign of hyperactive bowel sounds, hyperactive and normal active bowel sounds. And looks like your bowel sound seems to be normal to me. I don't see any sign of abnormalities. And then this time I'm going to go ahead and auscultate for the bruits over the aorta by using my stethoscope again. I'm going to check for the aorta. Then with the renal arteries and iliac arteries. Okay, I'm going to move down your pants a little bit, okay, to check for your femoral arteries. All right. Looks like I don't see any sign of abnormalities on your different side of arteries. This time, we're gonna go ahead and percuss your abdomen, okay? So this will gonna be a little bit discomfort to you, ma'am, okay? Just bear with me, please. All right. Looks like I don't see any sign of abnormalities by percussing your abdomen. And then we're going to move to the palpation of your abdomen by performing the light and deep palpation, okay? So this time we're going to apply light pressure, okay, with my both hands. We're trying to locate for any sign of masses and localized bulging and tenderness to your abdomen. Okay? And this time we're going to try to see for your deep palpation. Does it hurt when I do this?
No.
How about this? Does it hurt?
No.
Does it hurt?
No.
How about this?
No.
All right. And then I'm done with the palpation of your abdomen. This time we're going to assess for peritoneal inflammation, which actually we're going to check for the rebound tenderness on your abdomen, okay? So we're going to again apply a gentle pressure, okay? Does it hurt you?
No.
How about this?
No. No.
All right.
No.
I don't feel any sign of rebound tenderness, and does it hurts a lot? Does it cause any pain at all on her side? So it looks like I don't see any sign of inflammation on her belly. All right, this time we're gonna check for the Murphy's sign by applying gentle pressure again. Uh, on the Murphy's sign, we're gonna try to locate for any sign of gallbladder pain or acute cholecystitis. Okay, does it hurt?
No.
All right. And then this time, we're going to move to the Robson sign by applying gentle pressure in the left lower quadrant area. And tell me, does it hurts on your right side, okay?
No. No.
Okay. How about here?
No. 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 No.
All right. And then we're going to move to the Soa sign. This time it's going to be a little bit different because I'm going to ask you to lift up your right leg again and then try to reach my right hand against your knee. Okay. I'm going to try to flex it and tell me if that hurts. Does it hurt?
No.
All right. She told me that she don't have any pain at all, so I don't see any sign of inflamed appendix at this point. And then the other way around also, we're gonna try to do the obturator sign, okay? By doing it so, I'm gonna try to lift up her left leg. I'm gonna move it inward to apply some pressure on the right side of her abdomen, right lower side of the abdomen. Do you have any pain on your right lower quadrant area? Okay, so that means that there's no any sign of appendicitis on her side, okay? So after that, we're gonna go ahead and do the cutaneous hyperesthesia by trying to pick up the skin of her abdomen and tell me if that hurts.
No pain.
Okay. And this time, let me see if I can try to put a pressure on your lower abdomen. Does it hurt you?
No pain.
Okay, and that's what the cutaneous hypertresia is, and she told me that she don't have any pain at all. So this time we're gonna move to the liver. The liver, we're gonna try to see if we can percuss your liver, okay? And we're gonna start with the midclavicular area, okay? All right. Okay, I can hear the resonance here. All right. And this time we're gonna go ahead and try to see if we can palpate your liver, okay? Let me move to the other side of your abdomen, okay? We'll try to palpate your liver here, ma'am, okay? Sometimes you have to perform the hook sign, which actually you can put a gentle pressure with your fingers underneath the costochondral area, okay? All right. I can feel the edge of your liver right here. All right, perfect. Thank you. And then I'm gonna move to the other side, which actually I'm gonna try to see if I can percuss your spleen right here. Okay. So this time you're gonna feel a little bit discomfort here because I'm gonna try to percuss your spleen. Okay. I'm gonna start with the 6 intercostal space down to lower side of her rib cage, and then all right. And then I'm gonna try to see if I can palpate your spleen as well. All right. Your spleen is slightly palpable right here, okay? All right. Do you have any pain when I do this?
No pain.
All right. Thank you. Since that I'm already here in the left side, I'm going to try to see if I can palpate your kidney, okay? And tell me if that hurts, okay? I'm going to put my left hand underneath your left flank area. Do you have any pain when I do this?
No.
All right. Perfect. I'm going to move to the other side. Okay. I'm going to palpate your right kidney. All right. Do you have any pain when I do this?
No.
All right, perfect. All right. You don't have any sign of tenderness on your both kidneys, okay? And this time we're gonna move to the CVA, or we're gonna assess for the CVA tenderness, okay? We call it cost of vertebral angle, okay? So by doing it, I'm gonna try to locate for your 12 intercostal space of your thorax, okay? All right. And then I'm gonna try to see if I could stamp it with my lower side of my aspect of my fist. Tell me if that hurts.
No pain. No pain.
How about this one?
No pain. No pain.
All right. By doing it, so I'm trying to identify for any sign of kidney infection or pyelonephritis. Looks like everything looks fine to me, and I don't see any sign of tenderness. So looks like she has no any sign of infection on her kidney. And this time, I'm gonna ask you to lay down again, and I'm gonna pull up your shirts. Okay. We're gonna try to see if we can palpate the width of your aorta, okay? There's gonna be a little bit discomfort on your side, okay? All right. Then I can palpate the width of your aorta right here, okay? I don't see any sign of enlargement at this point, and there's no any sign of tenderness. If I do that, that hurts you? No?
No.
Okay, perfect. All right, thank you. This time I'm gonna ask you to sit at the edge of this chair. All right, we're gonna proceed to the nervous system assessment. So by doing it, we're gonna try to assess your mental status, okay? And then let me ask your name again, please.
Mariki.
And your date of birth.
November 2073.
All right, and tell me your date of birth.
November 2073.
And tell me where you are.
Clinic.
And who is the president of the United States?
President Trump.
All right, perfect. Looks like she demonstrated to me that she has no any sign of cognitive impairment. She has alert oriented time is 4. There's no any sign of disorientation. She could answer all the question right to me, okay? So with that, we're gonna proceed to the different cranial nerves, okay? So by assessing your cranial nerve number 1, I'm gonna ask you to close your eyes. And I'm gonna bring some stuff for me, and I'm gonna ask you to smell and tell me what is this.
Ginger.
All right. Good. You did right. Thank you. And this time, we're gonna go ahead and proceed to the cranial nerve number 2, which is actually your optic nerve. With this optic nerve, I'm gonna assess for your visual acuity by using this Snellen's chart. Okay, it's gonna be 6 feet away. 5, 6. All right. Do you wear glasses, ma'am?
No.
No? Okay. Perfect. Tell me what letter is this?
E. P H O L G P
All right. Looks like she did right. Then cover your right eye for me.
L E L T P F H O L C P
Okay. Perfect. Cover your left eye.
E L T F P H O L G P.
All right. Looks like she got it right. She actually got it the 2020 on my Snellen's chart without the corrective lens. And then this time, we're going to assess for your visual peripheral field. With doing it, so I'm going to ask you to cover your right eye again for me, okay? And tell me what number is this?
1, 2,
Okay. Cover your other eye.
1, 2,
All right.
3,
All right, perfect. And then this time, I'm gonna go ahead and use my ophthalmoscope to check for your size and shape of your pupil. All right, just look straight for me. Can you move towards here? All right, perfect. All right, looks like your pupil is equally reactive to light, and I don't see any sign of hemorrhage, and I don't see any sign of macular degeneration and abnormalities to your pupil, okay? And then after that, we're gonna check, I'm gonna ask you to follow this pen for me, okay? You do this, okay? Just look straight. Just use your eye. All right. All right, you looks like you don't have any sign of involuntary movement and there's no sign of nystagmus. All right, so this time I'm gonna ask you to follow my hand with your eye only, okay? All right. You have a good extraocular movement and I don't see any sign of abnormalities. Good, you have a good eye muscles movement, okay? All right. Therefore, then we're gonna go ahead and proceed to cranial nerve number 3, 4, and 6. Okay, so with that, we already checked for any sign of any abnormalities on your eye muscles, and then so we already did the eye movement. So with that, so we're gonna proceed to trigeminal nerve. Okay, so I'm gonna put my both hands to your jaw, and I'm gonna ask you to clench your teeth hard for me, okay? All right, and move your jaw from side to side. Do you feel any pain when you do that?
no pain,
Okay, all right. Thank you. Open your mouth wide. All right. Do you feel any pain?
no pain,
All right, perfect. And then we're gonna go ahead and check for your facial nerve and sensory muscles, okay? So I'm gonna use the cotton tips, okay, Q-tips. Tell me if you feel this, okay? Close your eyes for me. Can you feel this?
yes,
How about this?
yes,
How about this?
yes,
All right.
yes,
All right. Perfect. And then this time we're gonna check for your corneal reflex by using this Kleenex. I'm gonna try to attempt to touch your cornea or your eye, okay? All right, you're blinking real good. You have a good corneal reflex to me, okay? So I don't see any sign of abnormalities. Then we're gonna proceed to the cranial nerve number 7. With that, I'm gonna check for your facial nerve, okay? For your facial nerve, we're gonna try to see if we can, I'm gonna ask you to raise your eyebrow for me. All right. And then close your eyes real tight. Okay. Looks like you do have a good muscles here, facial muscles. Okay. And then I'm going to try to tell you to make a frown. All right. Pop up your cheek. Pop your cheeks for me. All right. Touch your tongue with your both cheeks. Okay, good. All right. Give me a big smile. All right. I don't see any sign of facial droop on your face. So it looks like you do have a good facial nerve muscles. Okay. So then, and I'm gonna proceed to the cranial nerve number 8. With that, so I'm gonna cover your right ear and I'm gonna whisper to your left ear. Okay. And follow what I say.
1, 2, 3.
Very good. I'm gonna cover your left ear and I'm gonna whisper to your right ear.
1, 2, 3.
Very good. Thank you. And then after that, we're gonna go ahead and move along to the cranial nerve number 9, which we're gonna check for the Weber's test and the Rain's test. Okay, by using my tuning fork. Okay. So tell me if you feel the vibration if or you hear this. Okay.
Yes.
Okay. On your left ear, can you feel it?
Yes. Yes.
All right. Good, good. And then we're gonna go ahead and move along to the uh, glossopharyngeal and vagus nerve. So by doing it, so I'm gonna ask you to swallow for me. Do you have any trouble when you swallow?
No.
All right. I'm gonna try to tell you say ah. Show
Ah.
me your tongue. All right. I can see your uvula. I can see your tongue. All right. And then this time, I'm not gonna perform any gag reflexes that you can talk to me, and we're gonna defer that exam. Okay. So then we're gonna move to cranial nerve number 11, which is actually um, check for your spinal accessory muscles. Okay. For the spinal accessory muscles, we're gonna ask you to shrug your shoulder against my hand. All right. You'll have a real good spinal accessory muscle. And this time, I'm gonna ask you to turn your head against my hand to your right. Okay. All right. Perfect. How about the other one? Perfect. And then for the cranial nerve number 12, we're gonna check for your symmetry of your tongue. Okay. I'm gonna ask you to sting your tongue out for me. All right. You can see your uvula. It's actually midline. And I'm gonna ask you to move your tongue from side to side. All right, just looks like you have a good muscles on your tongue. I don't see any deviation. Move you up, please. Down. All right, perfect. All right, and then we're gonna go ahead and proceed and check for your motor system. But before we proceed that, we're gonna check for your muscle back for your for checking if any sign of atrophy on your muscles. Okay, I'm gonna feel your muscle to your right, both arms, your biceps area. Looks like I don't see any sign of atrophy. Okay, and on your lower leg. Okay, all right, and then this time I'm gonna perform the muscle tone. Okay, so with the muscle tone, we're gonna try to see if you can rotate your arm for me. Okay, good range of movement. How about your left? All right. Good range of movement on your left arm. And how about on your leg? All right. You can flex. Good extension. All right. How about the right one? All right. Perfect. And then this time we're going to try to see the strength of your muscle. Okay. By doing it, so I'm going to ask you to do this. Okay. And if you could pull my arm. Perfect. You did good. Push. There you go. How about on your right leg? Push. Pull. push, pull. And then can you try to wiggle your toes for me? Good, good. All right. So looks like you have a good muscle tone and muscle strength. And this time we're gonna check on your coordination by performing the alternating movement or rapid alternating movement of your hand. By doing so, you're gonna do this real fast, okay? All right, perfect. And this time, I'm gonna ask you to touch your all fingers with your thumb. Do this. Perfect. How about the other one? Perfect. All right. You really did good, ma'am. And now, this time, after your coordination, we're gonna check your gait, okay? I'm gonna ask you to stand up for me, okay? On standing up, since that you're already on standing position, we're gonna go ahead and perform the Romberg's test. On the Romberg's test, I'm gonna ask you to stand up straight with your eyes closed. Stand up straight for me. Do you feel any dizziness, ma'am?
No.
All right. And then I'm gonna ask you to pick your both arms up. All right. I'm gonna touch your arm, your left arm, okay? All right, good. All right, good. Good. Perfect. All right. Okay, you can open your eye now. This time, uh, I'm gonna go ahead and assess for the gait. Okay. So by doing it, so I'm gonna ask you to walk back and forth. All right. You're walking straight. You're walking fine. Thank you. And then this time, you're gonna use your toe to walk straight. Perfect. All right. And then your heel, please. All right. You can tolerate it. That's good. Then you have a good gait. And I don't see any sign of abnormalities. Okay. And then for the sensory system, we're going to try. Okay. You can have a seat now, ma'am. I'm going to try to see if you can feel this pain and the temperature. Okay. By doing it. So uh, I'm going to try to poke your arm and tell me if it's sharp or dull. Okay.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
All right, perfect. And this time, I'm gonna check for your temperature if you can differentiate the hot and cold, okay?
Cold. Hot. Cold. Hot. Cold. Hot.
All right, perfect. You did right. You did right, ma'am. All right, and this time, uh, I'm gonna try to see if you could feel this. But when you feel it, just say now, okay?
Now. 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 Now.
All right, and then you're gonna tell me if it's one or two by using the tip of the straw, okay?
One. Two. One. Two. One. Two. One. Two.
Okay. It looks like you can the discrimination of this object, okay? And this time we're gonna try to use my tuning fork for the vibration, if you could feel this on your finger, okay?
Yes. 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 Yes.
All right. Awesome. You did it perfect, ma'am. This time, last but not the least, we're gonna use my reflex hammer to perform the deep tendon reflex on different parts of your arms and your joints, okay? So we're gonna first do the brachial reflex, okay? Perfect. All right, perfect. And then the radial area. All right, good, good. You have a good reflex here, man. All right, good, good. And this time, since that your chair is too low, we're gonna use this two pillow to elevate your chair, okay? So we're gonna perform the deep tendon reflex. We're gonna check your patellar reflex down here, okay? Good. How about your right knee? Good. And then we're gonna move to your ankle, okay? Perfect. All right, perfect. Looks like we covered all the deep tendon reflex. And seems to be we completed all the exams this evening. And I would like to thank you for your participation. You really did an awesome job,
Thank
Miss
you.
Peralta. And thank you very much. And I appreciate you, man.
Thank you.
Okay, bye.